Colon cancer. Colon cancer occurs in the large intestine or the large bowel and is a very common kind of cancer, second only to lung cancer in occurrence. The risk of colon cancer is higher in certain groups and ethnicities, as well as in people living in Western industrialized countries. The positive side is that colon cancer also has a very high rate of cure and survival. Colon cancer is also known as colorectal cancer. The large intestine has two sections, the upper portion is the colon and the lower portion is the anus or the rectum. Cancer in the large intestine can spread over both regions, which gives it the name colorectal cancer. The colon absorbs water and nutrients during food digestion. The rectum, on the other hand, serves to expel waste material from the body. There are 4 parts to the colon, and cancer can start developing in any of these parts. The cancerous growth in the colon usually starts as a polyp. A polyp is a small tissue growth. This polyp will grow into the colon and if left untreated it can develop into cancer over a period of time. A specific type of polyp, called adenomycin, is the primary seed of colon cancer. On an average, it takes 5 to 10 years for a polyp to reach a diameter of about 0.5 inch. This takes a further 5 to 10 years to develop into cancer. Though 20 years seems enough to detect and treat cancerous development, it is difficult to discern any growth for several years. Thankfully, there are many diagnostic techniques available to successfully detect any cancerous growth or polyps. Some common techniques used in diagnosing and treating colon cancer are barium enemas, sigmoidoscopy, colonoscopy, and biopsy. Apart from this, patients can be screened to discern any blood in the stool or unexplained iron deficiency to find out if there is any polyp or cancer developing. Colon cancer is a widespread disease, and a lot of research is underway to increase survival rates and aid early diagnosis. There are also many foundations that aid colon cancer patients and provide information to people. Staging colon cancer. When a doctor wants to evaluate the progress of colon cancer of one of his patients, he or she uses a method called staging. This method is about finding out to what extent the tumor, colon cancer, has spread to the other regions of the patient's body. Once the doctors figured out in what stage the colon cancer is, they will develop the best course of action or treatment. At this point in time, the system that is most commonly used for the staging process of colon cancer is called the American Joint Committee on Cancers (AJCC) TNM staging system. Simply put, this system used for staging places the patients into one of 4 stages. Stage 0, also known as carcinoma in situ or colorectal cancer. In this stage the colon cancer has been detected in the innermost lining of the colon. Stage 1. In this stage the colon cancer has already begun to spread. But the cancer is still in the inner lining of the rectum or colon. In this stage the colon cancer has not reached the outer walls of the colon yet. Stage 1 is also known as DUCA or colorectal cancer. Stage 2. In this stage the colon cancer spread more deeply into or through the colon or rectum. Possibly the colon cancer may have affected other tissue as well. In this stage the colon cancer hasn't reached the lymph nodes, bean-sized structures which can be found in the entire body that helps the body fight all kinds of infections and diseases. Stage 2 is also known as Duc B or colorectal cancer. Stage 3. When you are in this stage the colon cancer has now spread to the lymph nodes although it hasn't spread to nearby parts of the body. Stage 3 is also known as Duc C or colorectal cancer. Stage 4. In this stage the colon cancer has spread through the lymph node system to other nearby tissue. This is most commonly called metastasis. The organs that most likely are affected are the lungs and liver. Stage 4 is also known as Duc D or colorectal cancer. Recurrent colon cancer or cancerous cells. When doctors talk about recurrent colon cancer they mean that cancerous cells that have already been treated have returned. These cancerous cells could possibly have returned as colorectal cancer, but they might as well return in any other part of the body too. Risks of colon cancer in women and men. Cancer occurs when something goes wrong with this system, causing uncontrolled cell division and growth. Colon cancer is cancer of the large intestine, colon, the lower part of your digestive system. Most cases of colon cancer begin as small, non-cancerous, benign clumps of cells called adenomatous polyps. Rectal cancer is cancer of the last 6 inches of the colon. Together, they're often referred to as colorectal cancers. Colorectal cancer is the second most common cancer killer overall and third most common cause of cancer-related death in the United States in both males and females. Who is at risk for colorectal cancer? Men tend to get colorectal cancer at an earlier age than women, but women live longer so they catch up with men and thus the total number of cases in men and women is equal. Women diagnosed with uterine or ovarian cancer before age 50 are at increased risk of colorectal cancer. Women with a personal history of breast cancer have only a very slight increase in risk of colorectal cancer. The average age to develop colorectal cancer is 70 years, and 93% of cases occur in persons 50 years of age or older. You have a higher risk for colon cancer if you have the following: cancer elsewhere in the body, colorectal polyps, Crohn's disease, family history of colon cancer, personal history of breast cancer, ulcerative colitis. What are the symptoms of colorectal cancer? Symptoms of colorectal cancer vary depending on the location of the cancer within the colon or rectum, though there may be no symptoms at all. The most common presenting symptom of colorectal cancer is rectal bleeding. Cancers arising from the left side of the colon generally cause bleeding, or in their late stages may cause constipation, abdominal pain, and obstructive symptoms. On the other hand, right-sided colon lesions may produce vague abdominal aching, but are unlikely to present with obstruction or altered bowel habit. Other symptoms such as weakness, weight loss, or anemia resulting from chronic blood loss may accompany cancer of the right side of the colon. If your doctor learns that you do have colorectal cancer, more tests will be done to see if the cancer has spread. Colonoscopy is currently the only test recommended for colorectal cancer screening in average-risk persons at 10-year intervals. Colonoscopic surveillance, also called screening colonoscopy, needs to be available at more frequent intervals for individuals at high risk for colon cancer, for instance, those with a personal history of colorectal cancer or adenomatous polyps, family history of colorectal cancer, non-hereditary polyposis, colorectal cancer, or a predisposing condition such as inflammatory bowel disease. The first step to avoiding this ailment is prevention with regular tests at the doctor, but there are other ways of getting around this disease in between checkups. Nevertheless, it appears that increasing the fiber content in the Western diet would be useful in the primary prevention of colorectal cancer. It is recommended that physical activity messages promoting at least 30 to 45 minutes of moderate to vigorous activity on most days of the week be included in primary prevention interventions for cancer. The population prevalence for meeting proposed physical activity criteria for colon cancer prevention is low and much lower than that related to the more generic public health recommendations. Our bodies need lots of calcium. Our bodies need lots of calcium, and not only for building strong bones. Colon cancer prevention is one of the most exciting uses for calcium. However, instead of using calcium supplements, this study relied on low-fat dairy products to supply 1,200 mg calcium per day. Investigators found this amount of calcium decreased the incidence of changes in the cells lining the colon, which is often seen in the initial stages of colon cancer. A significant protective factor is adequate dietary calcium intake during the period of maximum growth, ages 9 and 25Y, so that proper peak bone mass is achieved by age 20 and 30Y and maintained until midlife, with only slow bone loss in the following years. As already noted, dietary surveys indicate a significant gap between the recommended calcium intake and the actual intake in the United States in the critical years of adolescence and young adulthood and later in life. In addition, several large-scale, recent studies in humans indicate a role for increased dietary calcium in reducing colon cancer risk, as briefly discussed below. Both men and women are equally at risk for colorectal cancer. Men over the age of 50 and women over 55 should have this test on an annual basis to detect colon cancer early. Yet colorectal cancer is the third most common malignancy in women after breast and lung cancer. Incidence is slightly higher in men than women, and is highest in African American men. It is believed that the time has come for a full scientific review of cereal grain enrichment with calcium and vitamin D as a low-cost, safe, and useful route for the reduction of osteoporosis and colon cancer in the United States in both men and women. Colon cancer and one simple test. Colorectal cancer (CRC) is the second leading cause of cancer-related deaths in the United States for both women and men. This disease surpasses both breast and prostate cancer in mortality, second only to lung cancer in the number of cancer deaths. Despite the fact that it is highly preventable, it is estimated that 148,610 new cases of colorectal cancer will be diagnosed and 55,170 people will die from the disease in 2006. However, when detected and treated early, colorectal cancer has a 5-year survival rate of greater than 90%. For that reason, routine screening is vital in the prevention and detection of this deadly disease. CRC screening. According to the American Cancer Society, beginning at age 50, both men and women at average risk for developing colorectal cancer should follow one of these 5 testing schedules. Yearly fecal occult blood test (FOBT*), or fecal immunochemical test (FIT). Flexible sigmoidoscopy every 5 years. Yearly FOBT** or FIT plus flexible sigmoidoscopy every 5 years ***. Double contrast barium enema every 5 years. Colonoscopy every 10 years. For FOBT, the take-home multiple sample method should be used. The combination of yearly FOBT or FIT plus flexible sigmoidoscopy every 5 years is preferred over either of these options alone. All positive tests should be followed up with colonoscopy. Colon cancer and prevention. The colon is one of the most important organs in the body. Its intended purpose is to return water and nutrients into our bodies and help us eliminate waste. American diets are low in fiber and digestive enzymes. This causes the body produce digestive enzymes at the expense of immune system enzymes. The low level of fiber prevents the colon from cleaning itself and causes a buildup of toxic matter in the colon. The buildup of toxic matter in the colon can lead to many health problems, the most serious of which is colon cancer. The weakened immune system is unable to fight the disease. Colon cleansing helps the body rid itself of toxic matter. This in turn allows the colon to aid in the digestive process and allows the production of immune system enzymes to return to normal. There are several ways to cleanse your colon. One is hydrotherapy, where a small disposable plastic hose is used to irrigate the colon. A licensed professional must perform this procedure. Similarly, enemas are often thought to cleanse the colon, but they have been shown to only clean the bottom portion and rectum. Herbal supplements are often used in colon cleansing as well. A plant product called psyllium is most usually the base of these treatments. The psyllium's fiber expands when it comes in contact with water, and the bulky material causes the bowel to contract and expel waste. There are also oxygen-based cleaners that turn the waste into liquid or gas and help it to be expelled. Another way is to do juice fasting. Juice fasting gives the entire digestive system a much-needed rest and for optimal functioning to take place once again after the break. In a nutshell, colon cancer can be preventable. If you find yourself having meals that are low in fiber, try doing a colon cleanse. A clean colon will mean a healthy colon and a better immune system for your body.